It is November 10, 2024, and we are still in Diabetes Prevention Month. We wear blue for diabetes, even though my daughter does not approve. In keeping with the NIDDK's theme, Take Charge of Tomorrow, Preventing Diabetes Health Problems, let's talk about eye disease. The retina is the part of the eye, you can't see it on the outside, it is a layer on the inside of the eyeball where the light sensitive tissue is. It is where the small blood vessels of the eye are. Diabetic retinopathy is a disease of the retina and is the most common cause of blindness in the United States. People can get damage to those tiny blood vessels inside their eye, and sometimes these damaged blood vessels can burst. Sometimes there's formation of abnormal blood vessels within the eye, and then that can lead to pulling on the retina. In the early phases, there are no symptoms. However, as it progresses, people can get floaters. I can see the blood within their field of vision, and there can be progressive vision loss. If a blood vessel suddenly bursts, people can have sudden loss of vision. So how do we prevent retinopathy? The same way we prevent the other complications of diabetes, by keeping the diabetes under good control. Unlike heart disease and kidney disease, where there are certain diabetes medications that can also prevent the progression or the development of those complications, there is no diabetes medication that's been specifically shown to decrease the risk of retinopathy. But we do know that maintaining good glycemic control does prevent retinopathy and its progression. As I said, early on in the process, there is no symptom. So it is important for people with diabetes to get regular eye exams, and not just a visual check. You need someone to look at your retina, to look at the back of the eye. Sometimes I'll have patients tell me that they haven't seen the eye doctor because their vision is fine. But you don't want to wait till it's not fine. You want the eye doctor to check and see if there are any abnormalities with the blood vessels, because there are things that the eye doctor can do to prevent progression. So if you have diabetes mellitus, whether it be type 1 or type 2, it is important to keep your blood sugars under good control, and it is important that you see an eye specialist on a regular basis.